Welcome back to part 2 of our discussion on preventive medicine in older adults. I'm Dr. Liliana Andrade, family medicine and geriatrics physician, and in this video we will be focusing on cognitive health, depression screening, mobility assessment, nutrition and weight management, and vision and hearing screening. These areas are key to maintaining quality of life and independence in aging adults. So let's get started. Cognitive decline can be subtle, and early detection allows better management and planning. The USPSTF does not universally recommend routine screening, but Medicare annual wellness visits require a cognitive assessment. Screening is recommended if there are patients or caregiver concerns about memory, confusion, or functional decline. Best screening tools are number 1, Minicog, quick and easy for primary care, number 2, Montreal Cognitive Assessment, MoCA, more sensitive for mild cognitive impairment, and number 3, St. Louis University Mental Status Exam, the SLUMS, which is an alternative to MoCA. If you want to hear more about MoCA and how to use it, leave a comment below. Why is the mini mental state examination not recommended anymore? Because licensing fees makes it less accessible, education and language biases affect accuracy in diverse population, and has lower sensitivity for early cognitive impairment compared to MoCA and the SLUMS. Red flags for cognitive decline are repeated questions or stories, difficulty managing finances or medications, getting lost in familiar places. Next step, if impairment is detected, is further evaluation with neuropsych testing, labs, imaging if it's indicated. Check for reversible causes like B12 deficiency, hypothyroidism, depression. Take in consideration care planning and advanced directive discussion. Depression in older adults is often underdiagnosed and can present as cognitive decline or somatic complaints like fatigue. The USPSTF recommends screening all older adults for depression when follow-up resources are available. Best screening tools are Geriatric Depression Scale, the GDS-15, which is a 15 yes or no questions, and a score more or equal than 5 suggests depression. Shorter options include the PHQ-2 or the GDS-5, useful in busy clinics. PHQ-9 is more widely used but may not capture atypical depression in older adults. Signs of depression in older adults are loss of interest or pleasure in activities, social withdrawal and isolation, unexplained fatigue or low energy, and cognitive slowing known as pseudodementia. Next steps for positive screen is rule out medical causes like hypothyroidism and vitamin B12 deficiency. Consider psychotherapy and or the use of SSRI treatment, and remember to start low and go slow. Encourage social engagement, physical activity, and structured routines. Falls are a leading cause of injury, hospitalization, and loss of independence in older adults. Who should be screened? All adults 65 and older should be asked about falls annually. Ask these 3 questions. Have you fallen in the past year? Did you feel unsteady when walking? Did you have a fear of falling? If yes to any of these questions, conduct further assessment. Time up and go test more than 12 seconds is a high fall risk. 30-second sure stand will test for lower body strength. If you want to be more thorough, you can perform the T90 gait and balance assessment. Interventions for high-risk patients include physical therapy and strengthening training like Tai Chi balanced exercises, home safety modification like utilizing grab bars, improved lighting, remove rocks, and medication review in order to exclude all the medications that can contribute to falls like sedatives, antihypertensive, etc., etc. Malnutrition is common in older adults and impacts recovery, immunity, and overall health. Older adults should be screened annually for malnutrition. Best screening tool is the mini nutritional assessment, which is quick and validated for older adults. Red flags for malnutrition are unintentional weight loss more than 5% in 6 months, low BMI less than 22 is concerning in older adults, and loss of appetite or difficulty eating. Ask this question: have you had unintentional weight loss? Are you eating fewer than 2 meals a day? Did you have difficulty chewing or swallowing? Are you experiencing a loss of taste or appetite? Interventions for malnutrition are encouraging protein-rich foods and small frequent meals. Consider oral nutritional supplementation like Ensure, Boost, Glucerna. Evaluate for depression, dental issues, or medication side effects. Sensory impairment significantly affects quality of life and increases fall and dementia risk. Adults more than 65 should have annual vision exam or sooner if symptomatic. Common conditions include presbyopia, age-related near vision loss, cataract, progressive lens clouding, glaucoma, for which you have to screen every 1 to 2 years in high-risk patients, macular degeneration, and diabetic retinopathy, for which is required annual dilated eye exam for diabetics. For hearing, the USPSTF finds insufficient evidence for routine screening, but annual checks are recommended for those with symptoms. Best screening tools are the whisper test, stand 2 feet behind and whisper a number or a word. The finger rub test, if patient can hear fingers rubbing at 6 inches and impairment is suspected, refer to audiology for audiometry testing, which is the gold standard. Preventive care in older adults should focus on maintaining independence, mobility, and quality of life. By screening for cognitive impairment, depression, falls, nutrition, vision, and hearing loss, we can significantly improve patients' outcomes. Thanks for watching, and if you enjoyed the video, please like it, share it, and subscribe.